Hey y'all, hope you're doing well wherever you are, that you had a good day, a good evening, and that you're maintaining from day to day. On this channel, I talk about technology and money and also trending news. If you're new here, welcome to the channel. And if you're returning, welcome back. I wanted to talk real quickly about the immersion of cannabis nursing. And it's interesting because nursing as a profession and how we practice nursing, regardless of our specialties, continue to evolve, especially as technology continues to be more and more pervasive throughout healthcare, inpatient, ambulatory, and perioperative arenas, aesthetic nursing. Technology just continues to evolve, and the profession continues to evolve. In addition to that, you see new specialties or new specialties, or even the different specialties of nursing. You see how they're practicing continue to evolve. There are newer specialties in nursing, such as virtual nurses. There's also nurses working in artificial intelligence. Cybersecurity. Now, there's also your traditional type roles, such as a burn nurse or a burn care nurse, or even a cardiothoracic ICU nurse. That's a very highly specialized type of nursing. There's correctional nursing. There's also nurses who work as domestic violence. There's forensics nursing, right? So as nursing as a profession continues to evolve, and as technology continues to be more pervasive, and also as the world changes, you're seeing changes in how nurses are practicing, but also the new specialties. So there is a specialty that is not new, but it is emerging, and it is starting to expand more. Now, cannabis nursing has been around for a while, and cannabis as a substance is still illegal on the federal level, but it is legal in up to somewhere between 35 to 40 states. And in those areas where it is legal, there is a profession, there's a specialty in nursing called cannabis nursing. Now, it's really interesting. Finally, after many years, the American Nursing Association earlier this fall finally recognized cannabis nursing as a specialty. And to be recognized by the American Nursing Association is very monumental for this profession. So I wanted to share this this article that I came across, that I knew that cannabis nursing has now officially been recognized by the American Nursing Association as a specialty of the profession. Now, the American Cannabis Nurse Association, maybe saying that incorrect, American Cannabis Nursing Cannabis Association, I may have that backwards, are now working on scope and standards for the profession or the specialty of cannabis nursing. And nursing as a profession has scope and standards. The scope and standards within nursing, for my non-nursing listeners, are those, it's like a standard. It's like to say, this is what you as a registered nurse can practice with. This is within your scope. For example, doing surgery is not, kind of like doing an appendectomy is not within the scope of nursing practice. However, assessing wounds and other types of care is within the scope. Standards is just what it sounds like to say, this is like the benchmark for how you do certain things. So even with scope and standards of registered nursing as a profession, there's also scope and standards for different specialties. Well, now the American Cannabis Nursing Association is working on scope and standards for their specialty, for that practice. But they're also working on planning to do a certification as well. And I just found that so fascinating, especially considering the stigma that there still is out there with cannabis. And when we're talking about cannabis, we're talking about it in terms of medicinal use, not for recreational use. So we're talking about it in this case, in terms of like doing medicinal, such as if you would take like a high blood pressure medication, or you would take a narcotic for pain, or something like Ozempic for your diabetes. And so Becker's reported out on the emerging specialty of cannabis nursing, and it's really interesting. So the article says, I did link this article in the reference right now in the description, so you don't have to wait until the live is over. But the American Cannabis Nurse Association are now, first of all, it has been a big stigma around cannabis nursing for many years, for reasons that are obvious that I don't have to state here. But the president of that association has talked about the risk that cannabis nurses, even before the American Nurses Association recognized cannabis nursing as a specialty. But these cannabis nurses have talked about, I've seen I follow one of the state association, a couple of them over on another social media platform. But they've talked about like the risk and the stigma of their profession. It is a profession. It is a specialty. It is for medicinal use to provide care for patients. But the president of their American Cannabis Nurse Association talks about the risk that those nurses have had to take for their professional careers. Times are changing. But she says, but we have to understand that there are generations of people who have been told that this is bad, and that's been their worldview. So it's hard to change people's worldview. They don't push it on anybody, or force their views, or try to change people's mind, but they offer an opportunity to learn. So like I mentioned, the American Nurses Association, I said earlier this fall, but it was actually back in September, the ANA formally announced the recognition as a specialty. And so they talk about, and this is if you're a non-nursing profession, a non-nursing person, for the American Nursing Association to make a statement on something as this specialty is huge. It is, the ANA is like one of the high, it is like one of the highest, if not the highest governing body in terms of like scope and standards for the profession of the nursing profession. But what I also found interesting is that the ACNA is also working on a formal credential that nurses can receive. So when I say credential, so that's like a certification. Okay, so in many different nursing specialties, do have like a certification. Like there's an oncology nurse certification for nurses who work with cancer patients. There's an emergency department nurse certification for nurses who work like in an ED. There for nurses who work in surgical areas, there's like a credential or certification. So they talk about, the ACNA talk about how they're working to develop scope and standards of what would be necessary to require as part of a formal certification. But I also found interesting that they're expecting to release those scope and standards in early 2024, and that's right around the corner, y'all. I mean, we're winding down November 2023. The new year will be here less than 60 days. So they're working to build out a credentialing process, examination. And then once they have that exam, they're going to apply for formal accreditation through the American Nurses Credentialing Center. So the ANCC is that governing body, or that body within the nursing profession that has like that not releases, but manages like nursing certifications for different types of specialties to say, okay, you can go to this test center to take this test. These are the requirements that you have to sit for this exam. They also help manage people like renewing their credentials or their certifications. And so the president of the ACNA goes on to say, we have really risked our careers by standing up for this and looking out for people who are trying to understand this more. She said they don't promote cannabis just for patients to have access to safe information and safe access as a medical treatment. So then they talk about, of course, because as I mentioned, it's not this substance is not legal at the federal level, but they did say in this article that the United States Department of Health and Human Services sent a formal request to the DEA to reschedule cannabis as a Schedule 3, which would establish it has a legitimate medical use. That's at the federal level, because it's already legal in several states. So it says that the DEA agrees to this change. It would open more pathways to more research in medical access. And that's what the American Nursing Association said. So for the ANA, again, to be coming out, recognizing this as a specialty, talking about what the U.S. Department of Health and Human Services are doing, it really is a shift to where even what you saw cannabis nursing or how it's looked at in the medical, in the healthcare field, like 5 years, 10 years ago. And they recognize that even if the laws change, people may still feel their way. But the ACNA says they're promoting like the education and science of it, and also the professionalism where registered nurses can learn about it and share their expertise with hospitals and health systems, even if cannabis is not prescribed as a treatment. So yeah, it's really interesting. I'll be sure to I have left a link to this article. Okay. That's it. I found this really fascinating, especially as you're seeing different specialties like cybersecurity nurses, virtual nurses working in artificial intelligence, and now cannabis nursing. As the world is changing, so is the profession of nursing and how we practice nursing. So that's it. If you made it this far into the video, thanks for listening. Please do like the video on your way out. Liking and sharing the video does two things. Number one, it helps this content get out into the algorithm. If you found it interesting by you liking the video, is you telling other people that you found this interesting, and it's helping educating and informing others. And it also encourages me to continue creating and finding and talking about content that you all may find interesting. Okay, you all take care of yourselves, and I'll see you in the next video.